Yeah. So we'll start the session now. So this is learning outcome 6 that we were doing. And then as soon as we are done with this, we will then proceed to the assignment discussion. So the medicines that have to be administered, and there's certain routes that they have for being administered. So these routes depend upon certain factors, like there's some individual preferences where the individual prefers something. And just give me a minute. Yeah, sorry for that. So there are individual preferences where an individual would want to go for a certain type of drug, or a certain, not a type of drug, but obviously that is something that the GP decides, but an individual themselves, they could decide, they would want probably an oral route and not a rectal route from underneath. For instance, you could have certain people who want tablet form or who want syrup forms. So that way there are different preferences. And people may prefer to take their medication in tablet. Yeah, this is what's mentioned over here. So the people who want to swallow tablets, and therefore they take their medicines in the liquid form, and the individual's condition. So for instance, even if they're okay with tablet forms, their condition, like they can't take medication orally, like there's a person in coma state, they can't take medication because they're not in their senses. So in that case, you would always go for other routes of drug administration. Um, and then there were all these routes. So oral routes, if you see, there are tablets, there are capsules, there are liquids, suspensions. You have all these different types. Then this protective coating also on certain drugs, that if they are harsh on the stomach, then you have a protective coating around them. Some capsules and suspensions may be taken before food, others with food, and others after food. It all depends upon how the drug is absorbed within the system. It is for this reason that we need to know what requirements every individual has, just to keep their comfort in consideration. Sublingual, so this route involves administering medicines that are not swallowed, so they are under the tongue. And they're sprayed just as you have the spray for angina attacks, pain relief, or there's some drugs that are anxiety relief, and they're absorbed quickly, and therefore they can take effect quickly. Then there's some drugs that you inhale. They're nebulizers, they're inhalers. uh, People who have respiratory distress, mostly they take these. So these give in cases of emphysema or asthma, they give instant relief. Okay, so there's bronchiectasis that may use people with bronchiectasis, which is a condition where uh, uh, your lung passages, they go very shrunken, and in that way you can use these for instant relief. So then they are intramuscular. So some drugs are taken intramuscular in the arms, legs, or buttocks, and they are absorbed quickly also into the bloodstream. And the intramuscular injections can only be carried out by a doctor. So a trained nurse or a doctor should be using that on a patient. Intravenous, so in the form of a drip in with a needle and a tube. So you'll again need a trained doctor or a trained nurse, obviously a trained doctor or a trained nurse. Subcutaneous instillation. So some drugs you need them for a longer period of time, such as some or contraceptives. So you want them for some years in your system. In that condition, you would want to go for uh, uh, subcutaneous inside the skin. So they're instilled within the skin, and they have slow what do they call it? They have slow release. Yeah. And then there's installation into the eyes, ears, nose. So they're liquid in form. Um, then there's rectal or vaginal pessaries. You have rectal enemas for constipation relief. These are invasive routes, and you need a trained person to and who's been given authorization to do so. You can administer medications via this route. Um, Topical, it involves administering medicines by applying them directly to the skin in the form of ointments or gels, for instance. They are usually administered for skin conditions like eczema or athlete's foot. These provide quick relief for symptoms like pain and itching. Then they're transdermal again, applied on the skin in the form of patches. They slowly are released into the bloodstream, absorbed from into the body. For pain relief or hormone replacement therapy as well. Other medications are also important. So this is a summary of all the types of medications that we mentioned earlier. Then coming towards some of the last bits. So, how to administer medication safely and in line with current legislation and guidelines, it is very important to know this. Because if you know this, then you are ready to administer drugs in a safer way. So there are legislations, guidelines, policies, and protocols that are in place and are set out, and set out your responsibilities and the working practices um, you must follow to ensure you administer medication to individuals and monitor the effects safely and completely. So, as an lead adult care worker or a personal assistant, you may be involved in certain instances where you're involved in supporting individuals with prescribed or a non-prescribed medication. Perhaps your job involves you preparing individuals' medications for them, administering different types of medications, monitoring their condition after administering the drugs, or completing medication administration records and disposing of out of date and partially used medication. So if you know these legislations, you're good to go. So legislations that are there, there's the Medicines Act 1968. You should have read through this. This act classifies medicines into legal categories, and the local pharmacist or dispensing doctor is responsible for supplying medication. Prescription is required, like from a GP or a dentist. The Misuse of Drugs Act 1971, this regulates the use of controlled drugs to prevent their misuse. It creates additional requirements for prescribing, storing, administering, and disposing of controlled drugs. So that they must be stored in a secure, controlled drug cupboard, witnessed by a trained member of staff being used when being administered. Health and safety at work. This requires both employers and employees to work together in promoting the safe work environment, and it reinforces the health and safety is everyone's responsibility, and including when reducing the risks posed by hazardous substances such as medicines. It establishes the key duties and responsibilities of all employers and employees in work settings to practice safely, including the administering of medication. Certain other ones are the control of substances, hazardous to health regulations, the Mental Capacity Act, the hazardous waste regulations. Please have a read of all of these. I can't read them for you. The Control Drug Management, Supervision and Management Regulations, the Health and Social Care Act 2008, the Misuse of Drugs Regulation and Data Protection Act. So just have a look at these. These are important dates to remember. Now we go on to explain how to complete the records for storage, administration, and disposal of medication. So when you're working as a lead adult care worker, you may be required to either administer medication to individuals or support them to do so safely and completely. All medication has has been prescribed by a doctor, nurse, or a pharmacist will be accompanied by a prescription, and it is your responsibility to check that the individual is administered the medication as set out on the prescription before administering the medication to the individual. The required information from prescriptions will include, so that you'll have the details of the medication, when are you giving it, how long are you giving it, the quantity that is included, the details of the individual, their ID, their birth, their address, etc. Details of the prescriber. So is it a doctor, a pharmacist, or a nurse, and the date. What is MAR? It is medication administration record. Okay, so this sheet contains detailed information about each medication that the individual has been prescribed. So it's got everything, all details about the medication and how frequently it has to be taken, and the times that it has to be taken, when it has to be discontinued. So this sheet will also provide information on any allergies that the patient has had on this medication or any other medication, and they're all specific to this particular individual. You should, if the individual refuses to take their medication, this will also be recorded on the MAR sheet, and you will know that already when someone else reads it. They know already that, yeah, this is the refusal case, and they should be aware of this. Then how do we analyze standard precautions for infection control for the administration of drugs? So you're supporting individuals. Just give me a minute, sorry.
It is okay, Daddy.
Yeah, sorry for that. I was having some issues there. Yeah, so when you're supporting individuals with administering drugs, you need to keep it safe and hygienic, and you're applying standard precautions for infection control, reducing the risk of infection spreading during the administration of medication. And these create a protective barrier that reduces the risk of pathogens or germs that are spreading. The main precautions: wash your hands, wear your PPEs, you know that already. Uh, you when there's someone who's swallowing drugs, there may be some um, spillages there, so you're protecting yourself and that person as well. Wearing personal protective clothing will be very important. Clean the set of PPE once you're wearing them, discard them. Cleaning your equipment is very important. Check it if it's clean before, and by only using correct method for cleaning equipment as per the manufacturer's details. Disposing of equipment and material is very important. So for instance, in a sharp box. So you have syringes that you're using, and then that medication goes into the appropriate bags. And this is life-saving. Okay. Understanding agreed ways of working for the administration of medication. So you must ensure you read, understand, and follow your employer's agreed ways of working for the standard infection control procedures to take when administering medication to individuals. If there is something you don't understand, then you must act by asking your employer or manager to clarify this for you so that you can apply good, safe working practices when you're applying medication. So these are some of the references for you to work on, to have a look at. So I'll stop sharing the slides here. Any questions here?
Yes.
Okay. I think there are no questions. Please start populating the chat box with your names there. We'll just start the
Doctor, please, I
assignment
have a
discussion.
question.
Yes. Yeah, Rachel.
Yes, please, regarding our assignment,
Yeah.
because we have not actually submitted any one, and we
Yeah.
don't know because we have been, taking unit 4, and we
Yeah.
have not been taught unit 1, 2, 3.
Mm-hmm.
So
That's fine. Yeah.
I'm just asking if when we are done with this, are we to just submit 4 instead of since
Yes.
we have not learned the other ones?
Yeah. So whatever assignment you will be doing, that is based on what unit you are taking. So because you've not taken the other units, they will come subsequently. Okay.
Right.
So
Okay.
it's not building on each other. Each unit is separate in its own. Okay. And this assignment is only for this unit. So you're not required, if you've not taken a unit, you've not studied a unit, you are not asked to
Required.
submit that
Okay.
here.
Thank
Yeah.
you.
No
Thank you.
problem.
Okay.
Thank you for asking that question. So it's clear now. Uh, yeah, here we go. Any questions in between? I'm happy to take them anytime. So this is the assignment discussion. Now, 2 points, please remember, because they've been texted to me specifically yesterday to remind the students by the administration. Just give me a minute so that I read it through for you all. Okay. Please, you need to ensure when you're giving your references. So these assignments, when you're doing these assignments, they will be referenced. Okay. So just to make sure that there's no plagiarism. Okay. So when you're doing these assessments, just a minute. Sorry. Just give me a minute. Sorry. Where did it go? Yeah. Yeah, sorry for that. So when you're doing your assessments, when you're doing the references, please remember you're doing it Harvard referencing style. Okay, so the referencing style will be Harvard referencing. And you must not use references that are more than 5 years old. Okay, whatever references you are using, unless they are mentioned over here in the presentations, or that's okay. If you're using references from the presentation, that's fine. But if they're references that you're using, they must be updated. They must be within 5 years. Within 5 years time, all references should be current. That means 5 years, not beyond that, and relevant, and they're published within the last 5 years. In addition to this, you are required to include a minimum of 10 references. You can go beyond 10 references, but the minimum count should be 10 references. Okay. So because that is to maintain the standard of your work for the level that you're working on. I hope that's clear. Sorry. Mm, this is not what I'm sharing. I'm sharing the assignment discussion, which is here. Yeah. So
Sorry,
again,
I'm
yeah,
sorry. Does it mean the reference of like 10 years ago is not acceptable? Is that what you're saying?
that is acceptable, but the maximum of your references, most of your references should be within 5 years time. So if you've got 2 or 3 references, let's say you've got 10 references, within those you have 2 or 3 references that are 10 years old or maybe even 20 years old. We need information that is not outdated. Okay, so there's some legislations that are already that were from many many years ago, let's say
Okay.
2014. So in that case, you don't have a choice, you can't keep that reference as earlier. That is understandable. But in case of when you're giving statistics, let's say you're saying that there are so many cases of COVID that have just been identified, so those should be the recent references. You should not be referring to um, way back 2019. That will be outdated. Okay, we need to know things that are happening right now. So only when you're giving current situations, you're talking about current situations, you will be using recent references. However, when you're giving a legislation, if that legislation has been renewed, you will give a renewed date. Otherwise, you go with the old date, even if it is a decade old. Okay, is that clear?
Okay, thank you.
Yeah, welcome. Thank you for that question. Okay, so the aim of this unit was to develop an understanding of the key features that are involved in delivering safe and consistent services in health and social care. This unit was looking at fundamental principles like person-centered practice, safeguarding and protection, as well as effective working relationships and communication, which underpin the work of all health and social care workers. So what are we doing here? So what the important points are, that take a specific organization. So think of any organization to start with the assignment, whether it's a PowerPoint presentation that we've asked you to make or a report that we've asked you to make. Okay. Based on that, you give an introduction about the chosen company or the organization. Let's say I'm working within the World Health Organization, or I am working for the University of Greater Manchester, let's say. So you write a little about the introduction of that company or that organization, whatever is close to your heart, whatever you're thinking of working on. Okay. And then give proper headings and subheadings. Make your document look presentable, professional, and number your figures and your tables and also your page numbers. Follow the numbering on the assignment presentation as against the assignment brief. Okay, and ensure that you have 12 to 15 references for this for this particular assignment. You need to have 12 to 15 references. Otherwise, generally, when there are no number of references that have been mentioned in any unit, you should be going by the rule of having at least 10 references, and the referencing style should always be in Harvard. Keep a word count check. So 20% is allowed, 20% above and below is allowed. Recommended word limit assignment report will be around 3,500 words. When there's grading in this course, we use pass or merit or a distinction. Okay, I hope this is clear. So this is just about the layout and your referencing. So there's an assignment declaration that you need to fill in that talks about the originality of your work, that it has not been copied. So it will have your name here, your student number here, the course name here, and these things that you need to tick box. So now coming towards the assignments. Okay, so the assignment number 1, you're thinking about an organization, so that is clear. So there are fundamental essential principles that underpin the work of all health and social care practitioners, and it is vital that workers understand and know how to apply these aspects which are key to service provision. For instance, person-centered practice, effective communication, and safeguarding and protection. So the study skills that we are looking at for assessing you in this assignment are critical thinking, your planning, organization, and time management, your research, your gathering of information, note-taking, summarizing, your analysis, your written skills, academic skills, including your referencing, your application of IT skills, and your reflection. How do you reflect? So your tasks are, task number 1 is learning outcome 1, which covers all the bits of the learning outcome. So for this task, you are applying for a role within a local health and social care organization, and you're required to prepare a training resource for the interview within your organization. And this should include a definition of person-centered practice, B, an analysis of how person-centered ways of working contribute to continuity of care. C, a description of the role of safeguarding and protection in person-centered practice. And D will be an explanation of the benefits of positive risk-taking for individuals accessing services. Okay, these are the 4 bits that you will work on to prepare a training resource for an interview. Okay, and your role is within a local health and social care organization. So you're preparing a training resource and you're writing down these points there. Okay, so you'll define this, you will analyze, you'll work on this, you'll work on this. This all has been talked about in detail in your presentation. So in order to gain a merit grade, you must also analyze how the 6 C's of care underpin person-centered practice. We have talked in detail about this. To gain a distinction grade, you must also analyze why it is important for health and social care workers to demonstrate person-centered values throughout their working practice. I hope that's clear. Task that can be done on a Word document. Okay, it's the task number 2 is related to all the learning outcomes of second learning outcome. So communication is the process to make contact with others, to understand their needs and requirements, and communication involves sending and receiving messages in a continuous cycle which is repeated and becomes an important part of all relationships. Using a health and social care setting, you are either familiar with or you have seen in the media. So let's say you've not worked in it, but you've seen in the media. Assess the methods of communication used by people accessing the services and people there. You need to prepare a report. That report will again be in a Word document. You need to describe the role of communication in health and social care. B is explaining the methods of communication used in health and social care. C is identifying the barriers to communication in health and social care. D is describing information handling and recording procedures. And the last bit is explaining the principles and practices relating to confidentiality in health and social care. I hope that's clear. Again, for just a merit grade, you will evaluate the factors. So you'll do whatever has been asked to do, but in addition to this, you will also evaluate the factors that can influence the maintenance of confidentiality in health and social care. And to gain a distinction grade, you must also go on to evaluate strategies used in health and social care settings to overcome barriers to communication. I hope that task is clear. Now, task 3. Let me see. Just give me a minute. 4, 5, 6. So I think, yeah, there are 6 learning outcomes. So 6 learning outcomes have been, you've been given 6 tasks. Now, task 3, if you're not clear in any point, please feel free to stop me. So when people are accessing health and social care services, there are infections that can be serious, life-threatening as well. So you have regular contact with staff, others using the service, family and friends, all mean infection can easily be passed around. So it is vital to ensure everything is done to help prevent infection occurring. You have been tasked with preparing a training guide for staff new to health and social care sector. In the guide, you are asked to A, explain the cause and spread of infection, B, explain the importance of preventing and controlling the spread of infection, and C is to explain how to reduce spread of infection. Again, to have a merit grade, you must also analyze how an outbreak of infection would be managed, in a health and social care setup. To gain a distinction, you would want to assess how risk assessment can contribute to reducing the spread of infection in a health and social care setting. Okay. Now the fourth learning outcome. So you're using a health and social care organization, again, of your choice, like let's say a care home or a healthcare setup, whatever you want to. Carry out an analysis and review of their approaches to partnership working. In your review, what should you include? Describe different working relationships in health and social care settings. Explain the role of an advocate in supporting individuals accessing services. Explain why it is important to work in partnership with others, and then to evaluate the role of teams in providing a coordinated approach to service delivery. Now, to gain a merit grade, you must also analyze how team leadership can address challenges faced by teams in health and social care. Any questions so far? You're coming towards one of the last ones. So task 5 is your learning outcome 5. There are many different types of care plans. We've talked about a lot of care plans in the health and social care, but they have the same purpose, which is to ensure that the person gets the same care at all times, to ensure that the care given is recorded, and to support the person to identify, manage, and hopefully meet their wishes and preferences and their needs. So you're supporting a person who's new to the service that you work at, and you are involved in preparing their care plan. The person is very anxious, not sure about what is involved in the care planning process. Prepare for them a short information leaflet. So this leaflet should be very short, succinct, very brief, where you're explaining the purpose of care planning. You're outlining the roles and responsibilities that are involved in the care planning process, and you're describing how to ensure the individual is involved in all stages of care planning and review. Now, the extension activities here is number one is to, if you want a merit grade, you must also analyze ways to overcome barriers to implementing care plans. And to gain a distinction grade, you must also critically review the challenges of developing care plans that meet the needs of the individuals and their agreed outcomes. Yeah? Do you have a question?
Yes, I
There's
have a
someone.
question.
Yeah.
My question is, this assignment, is it the same for everyone? Is it this particular
Yes.
assignment?
Yes.
Yeah, because it's like the one I was given appears to be quite different.
No, this assignment is for this unit that I have just covered. I'm not sure what assignment you're mentioning, but this assignment is the same for everyone. So all of you have to be working on these
Yeah.
points. Yeah.
Okay, for this particular unit.
Yes.
Okay.
I'm not speaking about any other unit.
All right.
Okay.
Thank you.
No problem. So when you're if you want a grade like a merit, you would want to analyze ways to overcome barriers to implementing care plans. And to gain a distinction grade, you should be able to critically review the challenges of developing care plans that meet the needs of the individuals and their agreed outcomes. Now coming towards the last, but not the least, learning outcome, number 6. The task number 6. So you're supporting the safe and correct administration of medication, which is the key function of the roles of many carers working in health and social care. Let me just have a look. It should be on Moodle, yes. It will be uploaded on Moodle as well. So you're reflecting on an occasion when you or someone you know were prescribed medication. Carry out research to enable you to complete an account relating to the person's medication and more broadly to the administration of medication. So in your account, you must describe common types of medication and their effects and their potential side effects. We've just gone through this. And then you need to mention. Yeah, you're welcome. So explain the different routes of medication administration. So you've done medication types, side effects, and the potential effects. This different routes of medication administration. Describe how to administer medication safely and in line with legislation and and guidelines. Explain the records to be completed for the storage, administration, and disposal of medication that is safe. Now, to gain a distinction grade, you must also analyze standard precautions for infection control for the administration of medication. So some useful tips are as below. So remember, just yeah. So you have 2 weeks now. Just ignore this date here. So this means we've just discussed this assignment today on the 11th of October. So 2 weeks from now is the 25th of October. So you will be submitting your assessment on the 25th of October, which means it's 2 weeks from now. So useful tips are read the tasks carefully, and there's some command verbs. Okay, so command verbs, they're broadly used as guidance command verbs. You can cover the tasks by writing. So for instance, if there's a command verb, so a task says to explain, define, or describe, you usually do it in 100 to 200, 125 words. Now, when it says to assess, examine, clarify, or analyze, you usually do it in 175 to 225 words. And the third is when they say to compare, contrast, or critically or evaluate, you use more words, and that's 250 to 300 words. Harvard referencing style should be used. So it's author date style. Okay. So this is how it's used when you're using it within text, like for instance, in a paragraph, and you have the reference list at the end. So remember that include books and journal articles, websites. And as mentioned over here, minimum of 12 references should be used. Give proper headings, subheadings, make your document look presentable and professional. Word count is 3,500 plus minus 10%. Plagiarism or similarity should be below less than 20%. Okay, so what date did we have? I think we had the 25th of October. Yeah, that's it from my side. Just before we leave, are there any questions? I'll just stop recording the session.